For the forearm fasciotomies of the upper limb on the volar aspect, you start 3 centimeters distal to the wrist flexion crease, centered between the thenar and the hypothenar eminences, incised proximally to the distal wrist crease, then angle across the wrist towards the ulnar border. Continue proximally with the curvilinear S-shaped incision curving radially across the mid forearm, then sweeping back ulnarwards to terminate at the elbow flexion crease. Protect the ulnar nerve behind the medial epicondyle over here. This incision allows access and division of the lacertus fibrosus. Take extra caution while decompressing the brachial artery and the median nerve over here. Decompress the median nerve and the ulnar nerve in the carpal tunnel and the Guy's canal. For dorsal forearm, you start 2 centimeters distal to the lateral epicondyle, saving the radial nerve over here. You draw a 10 centimeters line towards the midpoint of the wrist joint to access the extensor compartments. Moving to the lateral arm, address the lateral compartment by marking the line from the inferior border of the deltoid extending to the lateral epicondyle. Watch the distal end closely. As shown in the animation, the radial nerve pierces the intermuscular septum here to run anterior to the lateral epicondyle. For the dorsal aspect of the hand, 2 longitudinal incisions are centered over the second metacarpal and the fourth metacarpal. This allows decompression of the interossei and the adductor pollicis. Finally, for hand, make 2 separate volar longitudinal incisions, one along the radial border of the thumb metacarpal for the thenar space, protecting the recurrent motor branch of the median nerve, and one along the ulnar border of the fifth metacarpal for hypothenar space.